This is one child. These are 99 other children. And out of these now 100 children, at least 5 and as many as 11 will meet the criteria for attention deficit hyperactivity disorder, or ADHD, during their childhood and adolescence. ADHD, you say, but what might that be? The stories of ADHD go a little like this: having trouble focusing on what is necessary, not because you do not pay attention, but because you pay attention to too many things at once. Unless, of course, you're really interested in something, then you can get too hyper-focused and you can't stop it. Remembering that you really need to do something, but you usually end up doing it at the last minute possible. Forgetting things. Having trouble organizing things. Having a difficult time figuring out where to get started with step 1 and 2 and 3 and 4. Not being able to sit still when you need to. Or sitting still for too long, you probably shouldn't. It's almost like you're driven by a motor. Talking over others without meaning to. Extreme emotions. Like a lot of them. Including being too sensitive to criticism and rejection. Doing that thing that you know you shouldn't do, and then doing it again without thinking about the consequences. Having a hard time delaying rewards, like a sweet treat or buying something you like. You want everything now. Oh yeah, and boredom. Lots of boredom. But despite how this sounds, not everyone's story is the same. There are 3 different types of ADHD. Inattentive, where organization and planning are hard and attention goes everywhere that it shouldn't. Hyperactive impulsive, where sitting, silence, and patience are difficult. And then a combined type, which is something of a mix between both. There are also some misconceptions about ADHD that need to be clarified here. ADHD is not a behavioral problem. ADHD is not laziness. ADHD is not a lack of motivation, nor is having ADHD anybody's choice. The truth is, ADHD brains work and develop differently than non-ADHD brains. One of the main problems is that an important area of the brain, known as the frontal lobe, is unable to effectively communicate with other important areas of the brain. Brains use chemicals as their method of communication. We know that 2 of these chemicals, called dopamine and noradrenaline, are typically lower in individuals with ADHD compared to individuals who do not have ADHD. ADHD symptoms usually begin during childhood, and 60% of children will continue to have them throughout their adult life. Having ADHD also increases the chance that a child or adolescent will develop depression and anxiety. ADHD is highly heritable too, which means that it runs in families, and if a child has ADHD, often one of the parents has ADHD too. ADHD can cause difficulties at school, at home, and with friends. Children and adolescents with ADHD need a lot more time and effort to complete the same tasks as their peers who do not have ADHD. But having ADHD is not all bad. People with ADHD often have an increased level of energy, higher levels of creativity, and a tendency to be more extroverted, curious, and enthusiastic. People with ADHD also seem to have a unique ability to hyper-focus on interesting tasks, which can help them do things for longer periods of time. They can frequently think outside the box, and when they are challenged, they can come up with fantastic ideas. They can also be excellent multitaskers, which is important to be successful in many professions. But how do we treat ADHD? ADHD treatment requires a combination of medication and behavioral changes. Given that ADHD is mainly caused by poor communication within the brain, we need medication to improve it. Stimulants are the first option in this case. They increase the levels of the brain's chemicals, dopamine and noradrenaline, which improves brain communication. There are also medications that act in a different way and are often useful too. Medications usually work for about 70% of those with ADHD. Then, once the brain system is working better, people with ADHD are able to learn new skills and strategies through cognitive behavioral therapy and skill building programs, which will help them to deal with their ADHD difficulties. Additionally, schools can help by changing the way they evaluate kids with ADHD, using something called an independent education plan, or an IEP. When ADHD is treated, people find that they will gradually be able to do things they may have previously thought not possible. Once the brain's communication system is improved, people often have less difficulties in their day-to-day activities, in their relationships, and overall better control over their actions and feelings. They are also able to finally channel their high energy and multi-focus ability in a better direction. If you think that you might have ADHD, or you know someone that may have it, you should discuss it with your healthcare provider. And remember, the ADHD diagnosis is based on symptoms. There is not any physical test that can be done to diagnose it. Thank you for listening to ADHD in a nutshell.